Ottawa, back in the year 2000, we were following about 100 kids with IBD total, and now we're following almost 350. So in a very short period of time, the numbers have tripled, and other places around the country are seeing very similar things. Right. We found that the rates of pediatric IBD, so the rate of children under the age of 16 being diagnosed with IBD, has increased by about 2% per year between 1999 and 2010. But that rate is increasing most rapidly in kids under 6 years old. So 6 and under. I'll try that again. That rate is increasing most rapidly in kids under 6 years old. It's increasing by about 7% per year between 1999 and 2010. We were surprised that this very young group was increasing. On the other hand, when we think about it, and you speak to some of the older doctors who have been practicing for 20 or 30 years, they almost never saw children under 5 years old, and now it's almost a regular occurrence. So we're seeing it very regularly that there's very young children being diagnosed, whereas before it was almost unheard of. It's certainly a concerning trend. You know, it is what we're seeing. It's very concerning, and we need to figure out why that is. I think everybody was very interested, but I don't think there was a lot of surprise, actually. I think colleagues from around the world, especially in Europe, really have seen this same thing, that they're seeing many more young people. Other countries, so France and Scotland, have been able to describe this increase in kids under 10 years old. They don't have enough kids to be able to describe this smaller group, the kids under 5. So this was the first time that kids under 5 that really we were able to describe this increase. But they're certainly sensing that it's happening there as well. There's certainly a sense of concern, especially that we don't know why, that we don't have the research to understand why this is happening in such young children. We know that environment is playing a role, and we know that the environment's impact on the gut microbiome, so the bacterial composition of the gut, is certainly playing a role. We know that the microbiome is established by the age of 2 or 3 in most people. So something early in life is changing the bacterial composition of the gut, which is leading to this increased rate of IBD overall, and probably it's a stronger effect in kids under 6 years old.
You think it's a different disease altogether because it's showing up so early?
I don't necessarily think that. I think there's a group of children called infant onset IBD, so kids under 2 years old or under 1 year old, where it's a single gene mutation that's causing something to look like Crohn's disease. However, that is probably a different disease. That is probably something that's more immune system based than what we're seeing. I think the typical child who's between 2 and 6 years old, who we're seeing more of, does have a similar type of IBD, inflammatory bowel disease, but it presents differently. So it presents more with the colon being affected than the small bowel. The small bowel is more often affected in adults. It presents more often with blood in the stool and abdominal pain, whereas adults can present with problems around the perianal area, and as well as teenagers can present with problems with growth, their height. Young kids don't present that way, and that may be because we're catching it very early. So some of these cases may have gone missed years ago, and now that we understand the disease better and we have better access to specialist care and investigation, we're catching them earlier, and so they're presenting slightly differently than they would have before.
But it's like an adult disease that's just taking root sooner?
Partly. I think there is really a difference in this disease. It's hard to believe that we're missing kids. We were missing kids with bloody diarrhea 10 years ago that persisted, right? I think we're certainly seeing kids who we would never have missed 10 years ago, but there is a group of kids who we're seeing now that probably would have gone many years without being diagnosed, and now that we're more aware, we're diagnosing them earlier, and they're presenting differently.
And so do you have any theories of what's causing this?
So we have many theories. We don't have a lot of answers yet. So we know that there's a genetic component to inflammatory bowel disease, both Crohn's and ulcerative colitis. There's been almost 200 genes that have been identified that increase your risk of inflammatory bowel disease, but they only increase your risk by a very small amount. So we know that it's something in the environment, and the things that have been found in the environment, number one is cigarette smoking increases your risk. That's obviously not the case in kids under 10 years old. Nobody is smoking there. But we know that early life antibiotics, living in a northern climate, living in a western nation, living in a city as opposed to on a farm, so not being exposed to farm animals, potentially living in smaller families, all increase your risk. So this idea of the hygiene hypothesis has been out there. And we know that all of those things, what they have in common is that they change the gut microbiome, the bacterial composition of the gut. Well, one theory was vitamin D. So we know that Canadians have lower serum levels of vitamin D. We're not exposed to enough sunlight. And we know that if you surveyed us in the wintertime, probably about 40% of us don't have enough vitamin D. There's been an association between vitamin D and one of the genes that cause Crohn's, called the NOD2 gene. And it's also been seen in certain studies that low levels of vitamin D increase your risk of Crohn's disease flare-up. So it may be that not having enough vitamin D in us is causing an increased risk. It's not quite been proven yet, but it would explain that north-south gradient where northern countries seem to have higher rates. So in kids under 6, typically they'll present with blood in the poop, blood in the stool, as well as abdominal pain. Those are the most common presentations. Bear in mind that abdominal pain is very common in children under 10 years old. So about 25% of children have enough stomach aches that they miss school as a result. And that's very common and normal, and that's called functional abdominal pain of childhood. However, if you see blood in the poop, if you're having fevers without a cause that you know of, so no cold or flu or anything like that, and you're having recurrent fevers with abdominal pain, if the child is not growing well or not gaining weight normally, those are all red flags that parents need to be looking out for, and they need to see their family physician or pediatrician in order to look further into what might be going on.